get workup of the husband also done. That he is also 50% partner in infertility. PCOS and tobacco are the two most important factors for increase in infertility. Tobacco chewing is rampant. Gutka chewing is very, very rampant in all the males of all classes, all societies. Used to do alternative herbal therapies or something else like that. So that prompted me to start IUI here. Used to do.
Hello and welcome. Let me introduce myself. My name is Njamir. I work for Subhak Health Tech. It's a startup and we have got two products in the market. One is the underwash machine by Subhak, and then we have a home insemination kit called conceive. Beyond that, what we're trying to do is destigmatize infertility as much as possible, because in India it is a stigma and women usually bear the brunt of the stigma. And therefore, professionals like you coming on board and talking to us about a topic will ease people's mind and show them that people are talking and it's normal. Proceed, could you kindly introduce yourself?
Hello, good evening, everybody. I am Dr. Darshan Kulkarni. I am a practicing surgeon and gynecologist in a rural area called Shahada in Nandurbar district in North Maharashtra. This is a very small town. Our district is primarily a tribal district with 67% tribal population. And I've been practicing here for the last 15 years.
15 years is a long time for a lot of experience.
Yeah.
Thank you for coming. It's a great honor to have you, and Subhak Health Tech warmly welcomes you.
Thank you.
Dr. Darshan, would you agree that there is stigma around the topic of infertility?
Yes, most definitely so. In my practice, whenever an infertile couple comes, it is usually the lady who is presented as being infertile,
yes,
never the husband.
Yes.
So the lady is bought by her, either her parents or by her in-laws, to be shown to me for infertility. So whatever is their infertility is always associated with the woman. It is with great when we convince them that we have to get the husband also investigated. Then the light dawns on them that, hey, but for first thing is infertility means something it has to do with the lady in question.
Yeah.
Then it is we who have to convince them that we have to get workup of the husband also done, that he is also 50% partner in infertility.
Yes. So infertility hota hai, like according to WHO standard, is 40% male problem, 40% female problem, and 20% unidentified problem.
Yes, absolutely.
Yet, like you said, there are numerous doctors across the country who says that the woman only comes, and it's usually the in-laws who bring the woman.
Absolutely, this happens 99% of the times. It is after our intervention that the husband is brought into the picture.
Yes, and that also with great reluctance, I'm sure.
Great reluctance.
Do you see a changing trend with younger people, more educated people?
Yes. Actually, even I live in such a rural area, but even the couples who have a little bit of education, they are more open to our suggestions. The husbands are more open to suggestions to get semen analysis done. 10 years back, to get semen analysis done, they used to run away and never come back. So now definitely it's not a sea change, but definitely we are seeing a change that the male infertility is also getting accepted. Semen analysis is being done. The husband also comes every time the lady comes for follow-up. So definitely there is a little bit of change going on, and progress is definitely there.
Yes. And with more people talking about the issue, especially from doctors like yourself, more people will open their eyes and they will start realizing that it's a couple's issue.
Yes.
Do you see an increase in the infertility rate in your area?
Yes, it has definitely increased in the last 15 years. Maybe because it was wider acceptance or wider knowledge. But the incidence of infertility, the people who come to OPD every day, has definitely increased. It was not this much 15 years ago. Maybe because of more awareness and people are coming forward, but definitely we are seeing more patients with infertility many more times than what we were seeing 10 years ago or 15 years ago.
Definitely could be awareness also. And a lot of doctors attribute the pollution in the air, plastics and everything to the rising trend in infertility.
PCOS and tobacco are the two most important factors for increase in infertility. Tobacco chewing is rampant. Gutka chewing is very, very rampant in all the males of all classes, all societies in our area.
Okay.
And that is why I think that is definitely contributing to this infertility. And second thing, in the last few years, all these packaged foods and things have come up, and refined sugars and maida. So the incidence of PCOD has also increased in females. So PCOD and tobacco chewing, I think these are the most common factors which we find in infertility today.
In the area where you're practicing?
Yes.
So plastics, that's one, and refined food.
Yes.
Tobacco, yes. Well, a lot of people say, in the cities especially, we've got erratic sleep patterns, we have got a lot of stress factors, but in smaller cities, I feel that is less. What do you say?
Slightly less, definitely. The stress factor is definitely less. Thanks to mobile phones, everybody sleeps late now. But stress factor is definitely less.
Yes. What are the top reasons of infertility as you've seen across your 15 years of experience?
Madam, as I just said now, currently the top two reasons are PCOD and tobacco chewing. Because all these mechanical problems like tubal blockage or bicornuate uterus or septum, these are, we find them only once in a while.
Okay.
But practically every patient we come across either has PCOD. It is a couple problem. The lady has PCOD, husband is chewing tobacco, his semen analysis has poor result. He has either low count or poor motility or some sort of the problem or the other is there in his semen, and the wife has PCOD. Both the couple, both of them have some type or the other problem usually.
When you talk about PCOD, I spoke to somebody recently, and she said she is a very young mother, and she said that since the time she was around 22, she learned that she wasn't even ovulating because of her PCOD problem. Do you see things like that?
Yes, we do. Actually, with what your Subhag Health Tech, you give us that OM detection kit, which makes it very simple because in my practice, people come from far away. So to come for follicular monitoring every day, to come on 20-25 kilometers on bike, go back on 25 kilometers for follicular monitoring is very difficult for them. So OM detection kit, which you supply with your andro wash, that has made life much easier for us. And we do find people with anovulatory cycles that when we give the OM detection kit for 5 days and they come back with a single line on all 5 days. So anovulatory cycles, definitely we do see them quite a lot.
So that's a rising concern again.
Yes.
I was speaking to a few gynecologists from another era, and they were saying they didn't see these problems in such rampant numbers.
Yeah, they have definitely increased in the last few years.
What prompted you to start doing IUI from where you are?
Basically, my location is such that the nearest big city is 90 kilometers away. So till I started IUI, the nearest place where a couple could get IUI done was 90 kilometers away. So that was very far, and for them to go 90 kilometers on the day of ovulation to get a bus, or it was a logistic problem is a lot of there. It takes 2.5 hours to travel by bus, then go to the doctor, then get the IUI done, then come back. It takes a whole day. And then because of that, people used to be very reluctant. Because I started it here. Now they say, oh, IUI is being done here, then we will come. They can come from their village 15 kilometers, 20 kilometers, or whatever neighboring small villages are there, they can definitely come. But before that, they had to travel a long distance. And so even when we used to refer patients for IUI, they never used to come back. They never used to go there for IUI. And then they used alternative herbal therapies or something else like that. So that is basically when we used to send patients a long distance away, they never used to go there. Maybe 1 in 20, 30 patients used to go. So I thought that if I start IUI at my place, then probably more couples will start staying over here, and more people will go for this IUI procedure. And that is exactly what has happened in the last 6 months. See, our place is such, the nearest big city is Dhule, where we have 2 or 3 infertility specialists. But being 90 kilometers away, for Adivasi uneducated people to go exactly on the ovum when they are going to detect that ovum, and then they actually, when we ovum detection kit, it shows that second line positive. We call them, we give them HCG injection and call them next day for IUI. So to do this 90 kilometers away is very, very difficult, if not impossible. Only my minuscule percent who are highly motivated or educated people have done that. But most of our Adivasi population, tribal population, it is almost impossible for them to do all this. And so it was our thought that we will start it over here. We will do the best what we can, and we'll try and offer these services over here, so that then we can do it over here only. And it has definitely helped, because once they know, okay, this is going to be done in our place and we have to come here only, so they are comfortable with me because they have seen me 3 or 4 times. We have been treating them. We have had some sort of a rapport. Yes. And I am only going to do the IUI, then they accept it. Acceptance of the IUI as a procedure has increased because it is offered in their place. They don't have to go far away.
Yes, and it's too much of a bother to travel 90 kilometers one way just for an IUI. The entire stress of traveling itself will, I guess, stop the woman from getting pregnant.
Yes.
So you are doing fabulous job with our Androwash by Subhak. Have you seen much success in your area?
Oh, well, it's been 6 months since we have started with the Androwash by Subhak, and I think we have already had 4 or 5 successful IUIs. Definitely, it has. Definitely, we have seen an increase in our success rate. Compared to only what ovulation induction we were doing.
Yes.
Addition of IUI has definitely helped a lot.
That's up your game and everybody's game.
Yes.